Welcome to the Clear Gun Show. I'm your host, Dr. G, with a PhD. Today's episode is going to be a little bit shorter than normal as we go into the Thanksgiving holiday. We've got a couple of breaking stories for you guys today. We're going to discuss Pfizer's application for a new emergency use authorization status for a drug they're producing for COVID. We'll discuss Australia and how news just broke out of there regarding COVID over the last 2 days. Then we're going to go to Canada. We're going to talk about a study done in Canada regarding children and late diagnoses. Finally, we're going to end with Denmark. Denmark just released a public health study on vaccine mandates and COVID passports and how that affects the population. We'll wrap the show up with a few fun turkey facts, and that'll be it for the day. Starting off with Pfizer. Pfizer is seeking EUA for novel COVID-19 oral antiviral candidate. So the summary of this article is as follows. If approved or authorized, Paxlovid, which is the name of the drug, would be the first oral antiviral of its kind, a 3CL protease inhibitor specifically designed to combat SARS-CoV-2. Emergency use authorization submission includes clinical data from an interim analysis of the phase 2-3 EPIC-HR study, which demonstrated an 89% reduction in risk of COVID-19 related hospitalization or death compared to placebo in non-hospitalized high-risk adults with COVID-19. Rolling submissions have commenced in several countries, including in the United Kingdom, Australia, New Zealand, and South Korea, with planned submissions to other regulatory agencies around the world. So before going into the rest of this summary, first of all, what in the heck is a protease inhibitor? So protease inhibitors are antiviral drugs that are typically used to treat things like HIV and hepatitis C. The way that they work is they cleave or break two of the precursor proteins into smaller fragments. So those fragments that they're breaking are needed for the virus to grow and to infect the patient further and replicate. Now, if you notice in the title, they're also giving this COVID drug with another drug known as ritonavir. Ritonavir is also used in treatment with HIV and hepatitis C when you're using those drug cocktails because what ritonavir does is that it competitively inhibits the cytochrome P450 molecules that would normally metabolize drugs, or this particular drug, the protease inhibitor. So it inhibits that so it can't metabolize protease inhibitor. What that allows the protease inhibitor to do is to last longer in your bloodstream, continuing to do its purpose of cleaving the two precursor proteins. That's a little drug background. We might go back into that next week, depending on how this FDA thing goes. But let's go back to their statement. So according to Pfizer's statement, the data on Paxlovid demonstrated an 89% reduction in risk of COVID-19 related hospitalization or death from any cause in patients treated with Paxlovid compared to the placebo. This was within 3 days of symptom onset. However, they found similar results within 5 days of symptom onset. So the first of the trials were conducted in July of 2021. Now, they were randomized double-blind studies, which are great. And they were also in populations that were high risk of severe illness of COVID-19. Now, what's interesting is this is going to follow the exact same pattern as Pfizer's vaccination when they were in their trials. So at the recommendation of an independent data monitoring committee and with consultation with the US FDA, Pfizer ceased further enrollment into the study in early November due to the overwhelming efficacy demonstrated by the preliminary results. However, they also mentioned that in September, Pfizer initiated the phase 2 and 3 EPIC-PEP, which is post-exposure prophylaxis, to evaluate the efficacy and safety in adults that are exposed to SARS-CoV-2 by a household member. These trials are still ongoing. These trials are also among people who are at standard risk, which in parentheses they define that as low risk of hospitalization or death. So here's another therapeutic drug developed for COVID-19 to add to our toolbox. This is great news for high-risk patients. That being said, of course, we don't have any long-term outcome effects or safety in the long term. But if you're a high-risk patient and you're looking at potential death to COVID, well, this is a great alternative. What's interesting for the FDA is, and I'm not entirely sure how they're squaring this circle, and I do think it's going to erode even more trust in the organization, is they were part of the group that recommended the end of the original trials due to the efficacy. However, the FDA has yet to approve the drug, and there are current predictions just online that it might be approved as early as January 1st. But if it's so effective and they stop the trial already, why not approve it? I'm a little confused as to sort of the thought process. And I have no idea where to go to find out what's actually happening. That being said, governments around the world are starting to buy up Paxlovid. Now, the UK government, this is coming out of the BMJ, the UK government has purchased already 250,000 courses of Paxlovid and ritonavir. The UK's MHRA, which is similar to the FDA, is also reviewing the drug for potential rollout this winter. I'll most likely be following up with news on this particular subject next week as more comes out, but now let's go on to Australia. So this video broke early Monday, and it's of the Premier of Victoria, Daniel Andrews, discussing their new COVID plans. Let's hear what he has to say.
Urgent action to escalate our response in these communities, immediately implementing a hard lockdown. That means residents of Binjari and Rockall no longer have the 5 reasons to leave their home. They can only leave for medical treatment in an emergency or if required by law. It's highly likely that more residents will be transferred to Howard Springs today, either as positive cases or close contacts. We've already identified 38 close contacts in Binjari, and that number will go up. Those 38 are being transferred now. I contacted the Prime Minister last night. We are grateful for the support of about 20 ADF personnel as well as army trucks to assist with the transfer of positive cases and close contacts and to support the communities.
So your ears were not deceiving you. Those words were actually said by him towards the end there. They're using army trucks to move COVID positive cases to a different location. Now, the video quality is admittedly bad, so I was pretty skeptical. So I started going around and looking for different news articles discussing the topic. And within hours of this release, articles were popping up all over the internet. Here's a couple of them. So headline from ABC, Southern Australia Health Plans Regional Quarantine Camps for Indigenous Close Contacts. From the Daily Mail, inside the town with the world's strictest lockdown where residents are bundled into vans and driven to a quarantine camp, banned from going for a walk or buying food, as Indigenous elders issue a frightening warning. And finally, from The Guardian, Northern Territory communities of Binjari and Rockall in hard lockdown as COVID outbreak expected to worsen. So from The Guardian, it says the Australian Defence Force has been called in to help with transferring positive cases and close contacts. Now, the articles mentioned there was a low vaccination rate, but I didn't quite get from the articles whether or not it mattered if you were vaccinated. I think if you had a positive case, no matter what, you were being moved into the quarantine camps situation. So before YouTube, regularly I would mention Australia and how they were going crazier and crazier with their COVID response. And this, I hadn't mentioned them in a couple of weeks, and this just totally took me by surprise. Now, I guess we should have seen it coming, judging by how crazy the response has been in the preceding months, but here we are. Now let's look at what Ireland is saying about vaccines.
And I think, like others have said, gyms, hairdressers, but why not supermarkets? Why not public transport? I know it's difficult to police some of these things, but really, if you want to participate in society, you need to be vaccinated. And if you don't want to participate in society, okay, stay at home. That's your own business. But you're putting yourself at risk, but you're putting your families at risk, and you're putting the rest of us at risk, and you're putting the economy at risk. You know, none of us want a lockdown. It's in all of our hands to behave as best we can, but we can socialise safely. And particularly if you're vaccinated, it's unlikely to do you too much harm if you don't have another pre-existing condition. So please, Leader, let's have a proper discussion about it, and let's bring everybody, particularly new communities, may not.
So this governing member is discussing basically how they want to increase the use of a COVID passport, or to increase, I guess, the motivation to get vaccinated so you can go do public things. But if you'll notice at the around 30 to 35 second mark, he makes this really minor but extremely important delineation. He says, look, if you're vaccinated, you could probably socialize and have no problem, unless you have a pre-existing condition. This whole pandemic and the whole pandemic response has been filled with rhetoric like this. Rhetoric that leaves the door open for policies to come in on the back end to be more and more stringent with no metric. So for example, this politician is saying, look, yeah, for now everyone can go out and, you know, if you're vaccinated, talk. But you know what? If you're vaccinated and you have a pre-existing condition in 3 months, we'll see. Maybe you have to be locked down just like the unvaccinated. And that's because we're protecting you. It's a really kind of an insidious, in my opinion, way of going about things. And especially, we'll look here in a little bit at Denmark at this study about trust in public health policy. Now, the thing about public health is it requires trust. Public health requires trust, and it's being eroded with language like this. Finally, we'll take a look at Germany on this topic, and not to be outdone by Austria. This is according to the New York Times. Germany now has ticket inspectors on public transport, and they're going to be randomly checking passengers' proof of vaccination or recovery from COVID via a negative test. So if you don't have any of those required documents, you're going to be asked to leave the bus and could eventually face fines. I definitely can't see this spiraling out of control. Now I'm going to touch on an article that came out from Canada recently, and it discusses the late diagnoses of tumors in children and how that could be collateral damage from the COVID-19 response. This article follows an interview with Dr. Singh, who is a pediatric neurosurgeon, and early on in the article, it opens up with this kind of quote. "You can imagine a tumor that's the size of a ping pong ball. It's easier for me, Dr. Singh, to work around and remove it. But if that ping pong ball sized tumor grows to the size of an orange or a grapefruit, the tumor has grown to a size where it is much more difficult now to deal with." So this analogy is specifically referencing tumors in the brain that Dr. Singh has had to deal with. And what she notes is that she's seeing 2 to 3 times more orange and grapefruit sized tumors than the smaller tumors. And she is thinking that this is because of a delay in early diagnoses, instead of something like children are having just many more tumors that are growing significantly faster. So Dr. Singh lays out 3 bullet points that she believes have been causing patients to stay away from the hospitals. 1, they're afraid of catching COVID-19, and that's both patients and parents. 2, there is a lack of in-person visits with their family doctors. So not just the hospital, but with their local pediatrician. 3, there is this bias to look for COVID-19 symptoms, and that's to the detriment of other serious diseases. So basically, because COVID-19 is in everyone's face all the time, people are looking mostly for that. And if they don't find that, then everything is good. When in reality, there's a list, a series of things to look for that people seem to be neglecting, according to Dr. Singh, or may be neglecting. As far as how these cancers have presented themselves to Dr. Singh, she says, and I quote, "I feel like I've been practicing in a third world country. I've seen disease that has spread so far that it's almost like cases I've read about in rural India. It's been quite difficult and alarming." Again, this is in Canada. In a promising update, in October, the Ontario Ministry of Health and the College of Physicians and Surgeons of Ontario issued a letter encouraging doctors to resume inpatient visits over virtual appointments. Finally, Dr. Singh ended with this piece of advice to parents, and there's 2 pieces. First of all, she says it is safe to go to the hospital. Second of all, she says she really encourages parents not to accept a virtual visit as a proper way to diagnose your child. I think this is a great piece of advice, and I think this is a great article, and it's really shining the light on how we've neglected other parts of society when focusing only on COVID, and we need to return to a more balanced approach. For our final story, we're going to discuss a study that was published out of Denmark, and this is a preprint version, and it came out November 23rd, so yesterday. So this is one of the biggest papers I've read in a long time, but now it's out there, and so now we can not definitively say that this is the case, but there's more evidence to this being the case. But we didn't need a paper like this to know this would be the outcome. So this paper talks about the increased pressure leads to decreased trust among the unvaccinated, and they're discussing increased pressure in terms of mandates like COVID passports. So on November 8th, there was a press conference held by the Danish government, and they were reintroducing COVID passports as a way of containing the COVID-19 infections and making life as an unvaccinated person more burdensome. So here's a quote from the Prime Minister. Quote, "For all of us who are vaccinated, yes, there it is, easy. For all of you who are not vaccinated, it of course becomes more burdensome, and that is also how I think it should be. When there is this rise in the infections, which there is now, then it is because there is a small group that does not play according to the rules that you have to play by when there is a pandemic. And I cannot emphasize enough the unfairness in that a small group potentially ruins it for most of us. So in my eyes, there are no excuses. Also, not of a moral character to not go and get vaccinated." With a quote like that, how can anybody not like this Prime Minister? That's pretty amazing. So the researchers in this study thought, well, hey, this might raise the possibility that while the pressure put on the unvaccinated could increase vaccinations, it could also come at the cost of lower trust. And what's the problem with lower trust? Well, lower trust implies that they may be even more reluctant to, first of all, receive booster vaccinations in the future, but also to do a whole bunch of other stuff. Lower trust in a population for public health means less compliance, basically. So participants were 18 years old, and it was a random sampling based on age, sex, and geography. In order to determine whether or not they were vaccinated, the question was asked, are you vaccinated against COVID-19? And they had 7 different responses they could choose from. If you fell into response 1 through 3 or 5, you were categorized as unvaccinated. If you responded in category 4, 6, or 7, you were considered vaccinated. So in Model 1, for the predicted levels of trust in the political strategy, the unvaccinated fell an amazing 11 percentage points in terms of trust. There was also basically no trust change in the vaccinated. So this chart shows that it wasn't the case that the vaccinated got more trustworthy and the unvaccinated stayed neutral. It was in fact the case that the unvaccinated got less trustworthy. Now, there were a few other models and predictors, and the link to this paper is in the description so you guys can go check it out. But the bottom line is these researchers said, first, this implies that while pressure may increase vaccinations, it could also decrease compliance with other health advice and long-term motivation to receive booster vaccines. So this is an obvious outcome. If people don't trust you, they're not going to do what you say. Duh. But also they made a really good point at the very end or near the end, and that was that it's relevant to note that these findings were obtained in Denmark, and Denmark as a whole is characterized by high trust in the management of the pandemic and low pandemic fatigue among its populations, which is totally different than many other countries. They also say low fatigue, but in that video, in that compilation of videos that we showed on Monday, Denmark was there, and there was quite a few people in the streets marching saying, hey, we don't like this. So now on to one of America's most cherished holidays, Thanksgiving.
It might be a difficult conversation before people step into your house to say, whoa, wait a minute, where's your card, what's your status, before you walk into my home.
This is tough because people are all over the map on this, and they're also all over the map with their risk tolerance. But the rapid tests have made this a lot easier.
Right.
Because whatever people's vaccination status is, we can actually confirm safety on the spot. So if it feels like it's going to be weird, maybe make it kind of fun. Say we're going to start with hors d'oeuvres in the garage. You know, we'll have drinks, we'll do our rapid test, and then come on in, right? You can make it playful, make it fun, and then be able to enjoy the holiday because you're not worried about safety.
All right. Yeah. What about stamina? It's a 4-day weekend. Should you suggest people get on the road?
So one thing we've kind of lost track of in this whole pandemic is how to be human. And one way to be human is embracing your family that's coming in. Okay? You can invite whoever you want to invite, and when they show up, they're there. They're already there. Don't do the whole, let me check your passport, come in. Just enjoy your family that's coming to see you. If someone is so concerned about getting sick from COVID, they might not really enjoy family time anyway. I'm not saying, totally exclude them. I'm just saying that this is a time for family. So please, 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 I hope everyone can enjoy Thanksgiving with their family. You guys can come together, eat together, share together. That's what it's all about. Even in a pandemic, we certainly have a lot to be thankful for. So finally, I'm going to close out today with some facts that I got from this website called Best Life Online about Thanksgiving. So here are 5 facts from them that I got. Now they have a whole list, and the link is in the description if you guys want to go check it out. But let's go through these 5. So fact number 1, the day after Thanksgiving is the busiest day of the year for plumbers. Fact number 2, Americans eat 704 million pounds of turkey every Thanksgiving. Fact number 3, female turkeys do not gobble. Coming in at number 4, and I'm surprised this isn't number 1, tofu is the most hated Thanksgiving dish. And finally, turkey is not to blame for your post-dinner slump. Now they make a good point here in this article, and it's really quick, but people have been, quick to say that, well, turkey has tryptophan, and tryptophan is one of the amino acids that helps make melatonin, so that's why you get sleepy. But tryptophan is found in a bunch of poultry, not just turkeys. In reality, it's the fact that people eat a bunch, and when you eat a bunch, you get tired. That's just the way it is. So again, please enjoy your family. Have a great day tomorrow. Have a great Friday. I won't be here. I'll be out of town. I'll be back with more news for you on Monday. And with that, enjoy this video. Happy Thanksgiving.
Thank you for letting me be able to live to see them today. You didn't have to do it, but you did. God, and I thank you for it. In the name of Jesus, God. Thank you for all of them being here today, God. Thank you. Let them praise your name for it right now. Quit smoking so much, baby. So that smoke will take you out of here. Take you out somewhere. In the name of Jesus, God. Oh, God, save this family. God, save the grandchildren.